I did this from like a patient and like a nurse, like I combined them rather than just doing the patient. Okay, so management of care, you're gonna delegate and supervise the care of client provided by others, so like, you're gonna delegate something appropriate for an LPN or for like an RN, and you're gonna watch them, making sure that everything is going right, or like a CNA or a tech or whatever. Advocate for clients' rights and needs. Provide and receive handoff of care report on assigned clients, so then if you don't get that, then it's your job to like make sure that you get that, so you know how to like correctly take care of your clients. Recognize and report ethical dilemmas is huge. Practice in a manner consistent with the nurse's code of ethics. Verify the client receives education is also huge. So then they like understand what like medications could cause them, like these side effects or whatever. Recognize limitations of self and others and utilize resources for that. And then report client conditions as required by the law. So such as like your abuse, neglect, communicable diseases, etc. And then safety and infection control, a huge one is to document client allergies. Protecting the client from injuries, so cleaning up the room, making sure the call light is where it needs to be, or like making sure like there's like a night light on in the night so someone can go to the bathroom. Properly identifying the client when caring for them, so then that also has to do with your 5 rights of medication administration. Educate the client on the signs and symptoms of the medications so they know like what they should expect when taking certain medications. And then obviously to protect the client, we should know what we need to be wearing for each precaution, and then also how to properly like have good hand hygiene, and we can also teach the clients how to have good hand hygiene so they don't get sick. Yeah, so. Okay. Performing targeted screening assessments, such as like if the patient has something wrong with their vision or their nutrition, they have depression, all that sort of stuff. Yeah. And then you're gonna assess the client for abuse, neglect, and then make sure that you report it. As well as assessing the client's ability to cope with life changes and then provide support. And then for assessing the potential for violence, you're gonna wanna use like safety precautions for that, so you not only are protecting yourself, but also protecting the client. And then provide appropriate care for a client experiencing the visual, auditory, or cognitive alterations. And then also recognizing like a patient's nonverbal cues to different stressors. Okay, basic care and comfort. Assisting the client with physical or sensory impairment, such as using their devices. You wanna make sure that you're repositioning them every 2 hours so they don't get bed sores, things like that, and like also educating them on how important it is to make sure that they're like repositioning or whatever. And then assessing the client with an alteration in bowel and bladder elimination so they don't get the infections. Educating the client on the importance of skin assessments at home and in the hospital, and reporting any new like sore that they have. Educating on importance of orthopedic devices, such as like applying them, removing them, and why they should be using them. Implement measures to promote circulation, such as your passive range of motion, your mobility, things like that. And then educating the client's nutritional status and intervene as needed. So you want to assist and educate them on the importance of like intake and output, and like, that didn't make sense what I wrote here, but yeah. And then evaluate the client's ability to perform ADLs. So then for pharmacological, I looked up the most common medications used in geriatrics, And then obviously you need to educate your patients on different side effects that they could be feeling. So, yeah. And then also disposing of medication safely. We all talked about, like, if you have needles, like if you have diabetes, you're gonna put them in kitty litter or something like that. It's like not just like the garbage, or if you have extra pills, to flush them, just like things like that. And then you're gonna also, as a nurse, evaluate client responses to medications and like know if they're allergic to them, or ensure safety precautions are in place. So like a fall risk precaution, seizure precautions, making sure that their bed is in the lowest position when you leave the room. And then the bed sores again. And then the management of care for a client with a fluid and electrolyte imbalance, so different signs and symptoms that are associated with that, such as your fatigue, your numbness, tingling, and then recognize signs and symptoms of client complications, and then intervene. So a lot of this stuff is just like common sense. So question. Do I need to read it out loud? Okay.
But besides the right answer, I want you to tell me what we're looking for.
Okay.
What's the drug or the solution? So many of this stuff is, I spent all week with my students, the ones that I'm tutoring. It's what you're gonna be tested over.
Let's see. Yeah.
What's the?
So like isn't it like the iodine is associated with like a shellfish? Isn't that it?
Got
The
it.
shellfish
Yep.
allergy?
So either or iodine or shellfish, they cannot have the contrast dye because it's in the family. I had to read this 3 times, but I got it. I got it, I had to read it. There's a testing strategy. Which one just sounds the most wise, straightforward? I'm gonna leave enough space for you so you can come in and write what you wanna write. Yes or no? No. Oh, I'll take dictation for you. I know shorthand. Go ahead, call her up. Have him or her. No, okay. Next one, cross out the entire entry in the patient's chart and make a note stating the nurse note. The night nurse will write her note separately. Forgive the night nurse, because you know what? We get tired on night shifts. No, unfortunately not, right? So that leaves your answer. I remember when I was in a management position and having to deal with a nurse that fell asleep. And she was pregnant, and the husband was like, you know, how could I not be compassionate towards that? And because she had like 60, it was a nursing home, she had like 69 patients that she was responsible for. It stinks, but seizure precautions. What do you think? A's out, right?
Yeah.
Ugly, don't care. B, who do we save those rooms for?
Dementia, confused.
Our wanderers, you need to get back in bed, right? Who do we do D for? It's a real intervention for what?
Suicide precautions.
Yep, your suicide precautions. Or it's in some places, based on the, help me out, whatever germs they have.
COVID?
Like infectious, they'll just throw the stuff instead, yeah. Okay, awesome.
That's it?
Okay, well, don't get out of it, because I'm gonna, yep, you did fine, you did great, thank you. Y'all just make me think of all these things I wanna share. It's just for you guys to go into NCLEX prep with really strong foundation, that's all I want. Oh, let's start with the delegate and supervise care of clients provided by others. Question after question that I've taken this week with my students is the nurses, hey, I need you to go check and see if they're in pain. And let me know, because I'll come medicate them if I am. Hey, what color was her urine? Hey, what did her behind look like? Those are all what kind of questions? Assessment. And the question after question was a nurse trying to get a tech to go do something for her. Esther, have you ever heard of such a thing?
They do that to me all the time.
I know they do. They're asking you to do their job. Say, give me your money and I'll go do your job for you. This one, of course the rights are important. Provide and receive handoff of care. I read an entry today as a clinical instructor. I have to go in and I said, I facilitated or oversaw the care delivered by Hannah Miller today. The nurse, the emergency room nurse, attempted to give nurse-to-nurse report, nurse unavailable due to change of shift. How do you think that's gonna hold up in a court of law if something got missed on that patient? Not well, right? So I saw that literally today. Prioritize the delivery of care. Next semester, you're gonna get question after question after question about priority. Who's gonna die first? Who's gonna kick off? Who's going to La La Land, the forever La La Land, if you don't do something for them? That priority of care. Code of conduct, code of ethics. Here's the question. Patient has an order for Benadryl for itching. Patient can't sleep. It's 1 o'clock in the morning and they can't sleep. What should the nurse do? One of the answers was to give the Benadryl. That is operating outside of our scope of practice. The doctor specifically ordered the Benadryl for itching. Now, could that patient have been itching and a little bit insomnia? So you will see nurses do that, but the right answer is you're gonna call the physician and get something for sleep, because that's outside of your scope of practice. That's violating the code of ethics type thing. Verify the client receives their education, admission, discharge. A question that we took was, the patient had signed the consent. The surgeon had left the room. And the patient says to the nurse, am I going to get blood? What's the problem there? Was his education perhaps lacking? The surgeon should have said, this is the risk you have for needing blood products. So we're gonna go ahead and type and cross-match you to make sure that we have blood ready for you in the blood bank. So it would be you picking up on, ooh, something got missed. You sign your name on that consent as a witness, you should have no questions about whether or not they could possibly get blood, as far as the patient is concerned, that the patient has been told what the risks are for that. Receive, verify, and implement. The question that we took was, the nurse was busy, so yeah, she got a telephone order from the doctor, but she didn't write it, transcribe it electronically until the end of her shift, when she had a chance to sit down and document. That is, the doctor called you at 7 p.m. and you don't chart it till 11 and get it sent off to pharmacy. That's a delay in care. Report client conditions as required by law. So there is an ATI question about child abuse and what the nurse sees in the hospital. And ATI says, you go notify the next in command. I asked a nurse on peds today. She goes, oh my gosh, we are the reporters. We are held as mandatory reporters if it was a child that you saw in the hospital. Properly identifying client. They've got to have their name bands on. They may be too confused to tell you that they're Bruce Willis You guys know he has like dementia. Educate client regarding infection prevention. Are you helping them wash their hands? What's that? Where that even came from? What were you guys talking?
Oh, I was sad about Bruce Willis and she
No,
laughed.
It was just like how you just like casually just
I
like
know,
threw it in there.
because we have a lot to get through yet. It's very sad to me, because I actually really love Die Hard.
Mm.
There's a couple ones that he was in I really like. So the whole infection prevention thing, that they know the importance of hand washing, that they, somebody else would have been responsible for them doing their cleanse, like their Hibiclens, shower, or their chlorhexidine, whatever, that they wanted them to use pre-operatively, but then post-operatively as their nurse, you're like, here's your wipes, trying to reduce the amount of bacteria that could possibly get to that wound and cause a SSI. Surgical infection. Signs and symptoms of medications. One of the things that you guys are gonna be looking at when you are studying for this next test is, what do I need to be telling the patient about? That's just an awesome screen that everybody should be familiar with. Just all good. Oh, this is just a huge area. Huge area. We took questions over visual, we took questions over hearing, deficits. Oh, importance of orthopedic devices. Putting them on, taking them off, on a very basic 250 kind of level. What do I have to make sure of with my orthotic devices? My splints. Whether they're for my feet so I don't get foot drop, or for my hands so my contracture doesn't get worse. What have I got to be watching on my patient, or educating them if they're at home? 250.
Circulation?
Circulation. What about skin? Skin integrity. Implement measures to promote circulation, your SCDs, your TED-HOs. There are also great exercises. There's they're laying in bed, so they're flat on their back, feet to the ceiling, to the wall, to the ceiling, to the wall. Help to push that blood into those deeper vessels. We have them go around in circles with their ankles. That helps to with circulation. If you ever see a question, it's like every hour while awake, just like your insulin spirometer. Once a shift's not gonna cut it. They move once a shift, they're at high risk for blood clot. Nutritional stats, you guys did a really good job. I did a lot of grading. I did grading over break. But you know, what are those lab values? What's their albumin, their pre-albumin? What's their iron? What's their calcium intake? Especially when we know that, you know, foods rich in vitamin C is going to promote healing. Zinc is going to promote healing. All right, of course, ADLs. Do you remember which side you dress first and which side you undress first in someone who's had a stroke or has a weak side? You should look that one up.
You just the weak side first, so that their strong side can help you.
You got it. Yep. 250 still struggling with that. We'll get more into the meds. We know that really for the most part, NSAIDs are not really super recommended for our elderly population, a lot specific to renal function, and that their kidney function is not as great as they continue to age. Do you remember what I said, what was the premier, what's the best, the most preferred opioid in the geriatric setting? Not Demerol. What's the other one? It's the gold standard for peds as well. Right, morphine. Geriatrics, Pain, morphine is the preferred, like the gold drug. Dispose of medication safely. We have come a long ways in that. What the educational piece is now is to return to your pharmacy. That is the preference. They're saying that us flushing stuff down the toilet is doing all kinds of bad things to our environment. Even in the hospital, and I'm speaking for peds because it's been a while since I've been on med-surg floor, but in the med room, there is a thing where you put, when you have extra medication left over, yeah, they don't want it going down the sink. They don't want it in the drain. Calcs, making sure you guys know how to do your med calcs because they're not going to go away. Response to medications. Golden piece of information. If there is a pain scale offered in the answers and the questions about pain, you always pick the pain scale. Safety precautions in place, bed in the lowest position. You just did a great job with that. I don't need to reiterate any of that. I don't know if you guys have seen it. I certainly saw it when I was at Lutheran, where 2 nurses would go around and do checks. They'd be looking at booties and heels and elbows to make sure that there was no breakdown. Here, I think this great bullet point that Tiffany put up, if you can remember how you feel after you've had a bad case of the stomach flu, weak, so tired, and you can associate that with the fact that your electrolytes were off, you're gonna be able to answer a lot of questions correctly. Awesome, 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 awesome.